through the countries concerning the pandemic COVID-19. For the international scene, in the lack of solidarity, millions of lives are at stake. Welcome to our newsroom. Telephone conversation between the President of the Republic and the Prime Minister of Ethiopia. The President of the Republic, His Excellency Ismail Omar Guelleh, had a telephone conversation last night with the Prime Minister of Ethiopia, Abiy Ahmed Ali. They discussed the bonds of friendship and close cooperation between the two countries and two brotherly peoples, and the progress of the being carried out in the process of economic integration between the two nations. The coronavirus is a global pandemic that has now made its appearance in our regions was another topics of discussion between the two leaders. The President of the Republic, His Excellency Ismail Omar Guelleh, on this specific subject and the Prime Minister of Ethiopia expressed total convergence of views on the fact that their two countries, in accordance with the ethnic of community of interest and destiny that characterize them, views this pathology under the sign of synergy, cooperation and solidarity. In the same meeting, President Guelleh and Prime Minister Abiy Ahmed also discussed the main issue on the agenda in the region. It should also be noted that the two leaders took advantage of these telephone exchanges to discuss several other subjects of common interest on both continental and international issues. Djibouti and Ethiopia, which have long since made the wise choice of pooling and complementing their potential of wealth, are linked by excellent and fruitful partnership in almost all areas of activity. The Secretary General of the Ministry of Health, Dr. Salah Benoita Turab, has made a statement on the daily results of the COVID-19 advance on our country. The situation of the COVID-19 pandemic on the national territory remains stable. On the 25th March, 18 people, including 14 close contact of the positive cases and 4 passengers from the latest flight, all tested negative. In the Jesters Quarantine Center, 43 people are under observation. As for the Arta Care Centers, 11 people are treated to that according to the internationally recognized protocol. All these people are in a satisfactory conditions, and no one needs special care at the moment. We would like to address this to the health professionals who are working in the file for case finding, screening and care. Their commitment requires our recognition, but also our collaboration. We would also like to reiterate the importance of the respect of the measures barrier and the imposed containment. We will not stop saying stay at home. As part of the response to the spread of coronavirus, member of the government, including Minister of Health Mohamed Diriye, visit the patient control site at the interest of Peltier General Hospital. Indeed, the Minister of Health had given firm instructions to put in place this precautionary barrier mechanisms at all entrance to the country's main hospital facilities. Thus, the Peltier Hospital set up tents for patient trade and circuit to control the flow of traffic and counter the spread of COVID-19. Peltier Hospital has set up tents for patient triage and counters. The Peltier Hospital has set up several hand washings and disinfection units have also been set up. The purpose of these new devices is to strengthen the disinfection systems against any risks of spreading the COVID-19 virus through a preventive strategy aimed at protecting all persons hospitalized in the various specialized departments in this hospital throughout this period of health crisis. The country's hospitals are on maximum alert for the detection and prevention of COVID-19. As part of the response to the spread of the coronavirus, Health Minister Mohamed Diriye has given firm instructions to put in place precautionary mechanisms and barriers at the entrance to the country's main hospital. For example, the Sheho Hospital has therefore placed the triage tent and patient circuit to control the flow of traffic and counters the spread of COVID-19, and washing and disinfection unit and thermal control system were also installed upstream to filter users for our outpatient consultation. The purpose of these new devices is to strengthen the disinfection systems against any risks of spreading the COVID-19 virus through a preventive strategy aimed at protecting all persons hospitalized in the various specialized departments in this hospital. In accordance with the directives of the President of the Republic on the measures of social distancing and social distancing in response to the COVID-19 pandemic, the Ministry of Interior informs the population that all movement of vehicles is subjected to an administrative authorization. To this end, the head of the state requesting services are requested to present themselves at Djibouti Prefecture with a request address to the prefect specifying the reason for the journey and the name of the driver. It should be noted that the service and companies established by decree must update the traffic authorizations from their directorate. After the decisions of confinement announced by the President of the Republic, many shopkeepers are complying with the directives of the head of state. The arteries of the capital remains empty, and shops, coffee, restaurant, and other establishments receiving the public have all remained closed. The aim of these measures is to maintain safe distance between people. The National Police, Military, Coast Guard, and the road safety officers were mobilized on the capital's main road to carry out checks to ensure compliance with the new safety regulations. Containment measures are the only way to prevent the spread of the disease. The government is therefore urged to reduce the movement of people, the bare minimum, since human remains the preferred vectors for the spread of virus. The National Police and road safety officers, as well as the military and the Coast Guard, are on the alert to enforces these measures in the arteries of the capital, and the various crossroads in the banks and security measures have been applied to prevent the spread of the virus to the various state agents who have gone to collect their salaries. The various security agents are working hard to apply these measures and instructions, but still they are posted on all the main streets of the capital to ensure strict compliance with the new security instructions. As a result, the institutional confinement, the closing of public, private, and consular schools, training centers is extended from 1 to 9 April 2020, including the continuity of learning will be ensured by the ministry through teleeducation and distance learning. A detailed broadcast schedule and the necessary instructions will be transmitted to the effect on RTD. Parents are required to accompany their children to regularly attend the courses. For the international scene, Europe accounts for more than 2/3 of the world victims. It has been going on of more than a fortnight in Italy, 11 days in Spain, 9 in France, and only 3 days in the United Kingdom. In an attempt to slow down the coronavirus pandemic, containment has now been extended to many European countries, with the question is how long before we see effects on the curves of cases and deaths. For now, Europe continues to pay the heaviest price, with more than 2/3 of the world victims, more than 18,000 deaths, and more than 200,000 cases have been recorded on the old continent, according to the latest count from the European Centers for Disease Prevention and Control. Spain more than 3,500 deaths. The toll was particularly heavy in Spain. On Wednesday, more than 315 deaths have been recorded in all since the start of the pandemic. This is now more than China in terms of the number of officially recorded deaths. The medical profession is on the front line against the virus. Healthcare workers account for nearly 14% of the cases and contaminations recorded in the country. Spanish Parliament on Wednesday paid tribute to these health professionals who are more mobilized than even ever, but still in need of help. UN Secretary General Antonio Guterres called for global solidarity in faces of the COVID-19 pandemic, failing that millions of lives are at stake, millions of lives are at stake if solidarity is not exercised in the world, especially with the poorest countries. In the face of coronavirus pandemic, warned UN Secretary General Antonio Guterres on Thursday, it has been proven that the virus can be contained. It must be contained. If we allow the virus to spread like wildfires, especially in the most vulnerable regions of the world, it will kill millions of people. He told a video news conference, global solidarity is not only a moral imperative, it is in everyone's interest. Guterres insisted we must immediately move for situations where each country implement its own health strategy to one that transparently ensures coordination global response, including helping countries that are less prepared to deal with the crisis, he also argued. This is it for the news. Thanks for watching us.